Something is shifting underneath the surface of American life, and most people don't have a word for it yet. Stores are open. Traffic is moving. News anchors are talking. From the outside, the machine still looks like it's running. But go deeper, past the headlines, past the stock market numbers, past the GDP reports that politicians like to wave around, and you find a different picture. You find grocery bills that have quietly doubled. You find insurance renewals that look nothing like last year's. You find adult children moving back home not because they want to, but because the math stopped working for them. You find people in their 50s and 60s who did everything right, saved, worked, paid taxes, now wondering whether they miscalculated somewhere. According to HUD's 2024 Annual Homelessness Assessment Report, more than 771,000 Americans were without housing on a single night in January 2024. That's the highest number recorded since the federal government began tracking the data. At the same time, the National Alliance to End Homelessness confirmed that homelessness jumped 18% in just 1 year. Families with children saw the sharpest increase of all, up 39% from 2023. These aren't statistics from a collapsing economy. This is happening inside a country with a functioning stock market, a record-high GDP, and unemployment sitting near historical lows. The contradiction should stop you for a second, because it means economic growth and widespread instability are no longer mutually exclusive. They're happening simultaneously, and in the following 10 states, the distance between them is narrowing faster than anyone in power seems willing to admit. Start with the most stripped-down version of demographic reality. West Virginia is a state where more people are dying each year than are being born. Not as a one-time anomaly, not as a pandemic distortion, as an established, ongoing baseline that demographers now treat as the new normal. Between July 2024 and July 2025, deaths exceeded births in West Virginia by nearly 7,900 people, according to U.S. Census Bureau population estimates released in March 2026. The state's population declined by another 1,300 in that same period, making it one of only 5 states to lose residents year over year. Over the last decade, from 2015 to 2025, West Virginia's population dropped by 4.3%. Since its peak in the early 2010s, the state has shed more than 80,000 residents. And the counties hit hardest, McDowell, Mingo, Wyoming, Logan, and Boone, are the historic heart of the West Virginia coalfields, the very places that once powered the state's identity and economy. The mechanism behind this isn't complicated, though the consequences are. Decades of coal-driven employment collapsed. Younger workers left for opportunities elsewhere. Those who stayed were older. Birth rates dropped as the working-age population thinned. Over time, the demographic structure tilted so far toward aging that it can no longer regenerate itself naturally. In the 16-county Central Appalachian sub-region alone, every single county posted a population decline between 2020 and 2025. Not one exception. What this produces on the ground is a state that is paying to maintain infrastructure, roads, schools, hospitals, emergency services, designed for a population that no longer fully exists. Fewer taxpayers funding the same fixed costs. That math gets worse every year it goes unanswered. Picture a 70-year-old woman in rural Mississippi, 50 miles outside the nearest town with a full-service hospital. She experiences chest pain late at night. A call goes out. Help arrives. Then comes the drive, and the nearest functioning cardiac unit is almost 2 hours away. That is not a hypothetical situation. It is a scenario playing out with increasing frequency as Mississippi's rural hospital infrastructure continues to deteriorate under financial pressures that show no sign of reversing. Mississippi's top health official, Dr. Daniel Edney, testified before state senators that 54% of the state's rural hospitals, 38 facilities, are at risk of closing immediately or in the near future. According to KFF, formerly the Kaiser Family Foundation, Mississippi tops national rankings for states facing extreme risk from federal Medicaid funding cuts. And Mississippi is one of only 12 states that has still not expanded Medicaid, leaving a significant portion of its low-income population without coverage and leaving hospitals to absorb enormous uncompensated care costs. The loop this creates has no clean exit. Rural hospitals that treat the most vulnerable patients lose money doing so. When operating margins go negative for consecutive years, the facility closes. When it closes, the community loses its largest employer and its only nearby source of emergency care. Health outcomes worsen. The burden shifts to the next facility down the road, which is now handling a larger patient volume with no additional resources. Mississippi already has the nation's highest fetal mortality rate, the highest infant mortality rate, and leads national rankings in diabetes, obesity, and cardiovascular disease. The population with the greatest medical need is living in a state where the infrastructure to meet that need is actively disappearing. According to the Mississippi Public Health Association, more than half of Mississippi's 82 counties are considered medically underserved. Some residents in the Mississippi Delta travel an average of 75 miles just to reach primary care services. The legislation signed into law in 2025 is projected to cut roughly $1 trillion from Medicaid and ACA-related programs nationally over the next decade, according to the Congressional Budget Office. For Mississippi, that translates to a projected $160 million annual loss in state-directed hospital payments beginning in 2029. For a state where more than half its rural hospitals are already on the edge, that is not a policy adjustment. It is a structural removal. Here is a state that should not be on this list. Chicago is one of the most economically productive cities in the world. It anchors global finance, logistics, manufacturing, and healthcare. O'Hare International Airport remains one of the busiest transit hubs on Earth. The state holds world-class universities and a deep talent base. By every conventional measure, Illinois should be a state people move toward. Instead, Illinois has lost net population for multiple consecutive years. Not because of catastrophic failure. Not because of a singular crisis. Because of accumulation. Property taxes across many Illinois counties rank among the highest in the United States relative to home values. State income taxes have risen. Municipal pension obligations, particularly in Chicago, have created fiscal pressure that filters down to residents through higher fees, reduced services, and infrastructure that costs more to maintain than the tax base can comfortably support. The cost of staying has been quietly outpacing income growth long enough that it has begun to change behavior at scale. The result is visible in what demographers call domestic outmigration. People who grew up in Illinois, built careers there, raised families there, are leaving. Not all at once. One family at a time. A retired couple who moves to Indiana after the property tax bill comes in. A young software engineer who accepts a job in Austin and doesn't return. A small business owner who does the math for the third year in a row and concludes the margins simply don't work anymore. Meanwhile, according to HUD's 2024 data, more than half of Illinois' homeless population consists of families with children, one of the highest family homelessness proportions in the country for a state with one of the country's strongest urban economies. Illinois isn't the state that triggers alarm. It's the state that produces exhaustion. A trajectory of quiet exits, compounding annually, with no single moment dramatic enough to force a reckoning. Oregon built a specific public identity over decades. Environmental consciousness, progressive governance, a genuine commitment to livable communities. Other states studied Oregon's approach to land use and social services as models worth replicating. That reputation is real, and the people who built it largely meant what they said, which is exactly what makes the data so difficult to process. According to HUD's 2024 Annual Homelessness Assessment Report, 56% of homeless families with children in Oregon are unsheltered, meaning they are not in emergency shelters or transitional housing. They are outside, in vehicles, in parks, in encampments. That percentage is the highest in the United States. Oregon's unemployment rate stood at 5.2% as of January 2026, roughly a full point above the national average of 4.3%. When jobs are harder to find and rents remain elevated, the margin between stability and crisis narrows for a much broader segment of the population than most people recognize. Oregon's housing supply has failed to keep pace with demand for an extended period. Zoning restrictions, elevated construction costs, and slow permitting processes have constrained new housing in ways that push rental prices far beyond what lower and moderate income households can sustain. The uncomfortable question Oregon forces is not whether its leaders care. Most evidence suggests they do. The question is whether caring translates into outcomes when the policy mechanisms aren't functioning at the speed or scale the problem requires. A state can hold the right values and still produce the wrong results. The data doesn't grade on intention. It measures results. And on the specific metric of unsheltered family homelessness, Oregon's results are the worst in the country. There is a particular kind of institutional failure that is harder to address than an acute emergency. It happens when a problem persists long enough that society stops treating it as a crisis. It gets absorbed into the background. It becomes scenery. And once that happens, the political pressure to resolve it quietly evaporates. Washington state is living inside that process. The state has the second highest number of chronically homeless individuals in the nation, behind only California. Chronically homeless, in HUD's definition, means continuously without housing for at least 1 year or repeatedly so over multiple years. These are not people moving through a difficult stretch. These are people for whom homelessness has become their permanent condition. Nearly half of Washington's single homeless adults fall into that chronic category. What makes this particularly striking is the backdrop. Washington has some of the highest average wages in the country. Its economy is anchored by major technology firms, strong exports, and one of the most productive workforces in North America. Economic growth and entrenched homelessness are not contradictions here, they are simultaneous realities. That's the core signal Washington sends. Prosperity concentrated at the top does not automatically generate housing stability for people at the bottom. Without deliberate policy mechanisms connecting growth to affordability, the two can coexist indefinitely, each operating in its own lane, without ever intersecting. The costs of chronic homelessness don't disappear because the problem is normalized. They accumulate in emergency rooms, in law enforcement calls, in untreated mental health and substance use conditions that require intensive and expensive intervention. The bills grow every year even as the public pressure to address the underlying cause quietly fades. Louisiana's crisis is distinct from every other state on this list because part of what it is losing cannot be negotiated with, legislated around, or funded back into existence. Louisiana is losing land. The coastal wetlands along the state's southern edge are subsiding, eroding, and being reclaimed by the Gulf of Mexico at a rate that has no comparable precedent in modern American geography. NOAA projections, based on observed land loss rates and measured sea level trends, suggest Louisiana could lose hundreds of thousands of acres of coastal wetlands within a child born today's lifetime. In some areas, the shoreline is expected to retreat significantly inland. A century of river engineering, decades of oil and gas extraction, and global climate processes that Louisiana neither caused alone nor can reverse alone have combined to produce a physical loss of territory. The financial consequences are arriving in homeowners' mailboxes every renewal cycle. According to 2024 data, the average homeowner's insurance premium in Louisiana reached $4,031, compared to a national average of $2,423. For residents in coastal parishes, layered policies covering homeowners, flood, and windstorm coverage can approach $14,000 per year. In February 2025, roughly 18% of home sales under contract in New Orleans were cancelled because buyers couldn't secure affordable insurance, up from about 10% a year earlier. Major private insurers have pulled back from Louisiana's market due to escalating storm risk and losses. What remains for many residents is the state citizens insurer of last resort, which itself operates under financial strain. For lower and moderate income households, housing plus insurance plus utilities has become a combination of costs that is genuinely untenable. Each renewal cycle makes the decision to stay harder to rationalize. Florida executed one of the most effective relocation campaigns in American history. No state income tax. Mild winters. Housing prices that looked genuinely accessible compared to the Northeast. For retirees and remote workers fleeing high-cost cities, the value proposition seemed real. For a period, it was. The cost structure underneath that promise has fundamentally changed. Florida now ranks among the most expensive states in the country for homeowners insurance. Major national carriers have stopped writing new policies in some counties entirely, routing homeowners to a state-backed insurer of last resort that is itself under significant financial pressure. As ocean temperatures rise and storm intensity follows, the actuarial math for private insurers has simply stopped working in large portions of the state. The insurance pressure is not the only layer. Condominium associations across Florida, responding to regulations updated after a building collapse killed 98 people in Surfside in 2021, are now required to fully fund maintenance reserves and complete deferred repairs on set timelines. For owners of older condominiums, this has produced special assessments reaching tens of thousands of dollars with limited notice, in some cases within months. Florida's job market remains functional, but it is dominated by service sector employment that does not produce incomes capable of absorbing rising insurance, HOA fees, and utility costs simultaneously. For residents on fixed incomes or mortgages sized against assumptions made 5 years ago, this isn't an abstract future concern. It is a present, monthly financial reality that is steadily narrowing the margin between stability and stress.